One of the great concerns that practicing clinicians and embryologists have had might be that something we do clinically actually influences or increases the rate of aneuploidy in embryos. We know that perhaps the single greatest factor which prevents embryos from being reproductively competent, able to make babies, is the fact that they end up with too many or too few chromosomes, aneuploidy. Some data from animals have shown that stimulation, what we do to get multiple eggs to develop in a cycle, might actually increase the risk of aneuploidy. And there were some other preliminary retrospective data in the human model, which also suggested that maybe these stimulations are increasing that risk. Obviously, the central tenet of medicine is first do no harm. We would never want to do that. It has led some clinicians to take a pathway which is much less efficient, natural cycle or minimal stimulation IVF, with intrinsically lower outcomes, but might be able to help some people who might be at risk for aneuploidy and suffering from this adverse effect. And so, of course, we really did not know. So the only way you can really study this is to do a natural cycle IVF study where you measure the risk of this aneuploidy, this gathering too many or too few chromosomes, and compare that to stimulated cycles. And in fact, Kathy Hong has recently done such a large prospective study. In that study, Kathy and her group of investigators took many patients, all ages, all possible ranges of patients pursuing infertility care, and put them through a natural IVF cycle so that she could see what the risk of chromosomally abnormal embryos might be. Now, we have known for a very long time that it's lower when you're young, and it rises as the female partner gets older. She did hundreds of these cycles, and in doing that, she has demonstrated the fact that the risk is just the same. This is really important clinically. So when patients have a completely natural cycle, their risk is the same as someone at their same age who's undergoing a stimulated cycle. The take-home point is simple and very clear. Patients do not need to be worried about whether or not something their doctor's doing in stimulation increases the risk of abnormality. It does not. Ovarian stimulation, so that we can get more follicles and more eggs, more chances and much better outcomes, does not increase the risk of an adverse outcome. So this is perhaps the most important safety message to come through in ART treatment in decades. And certainly we're all very proud of Dr. Hong and her work.